donating at cherrystreetmission.org.
Welcome back. We have Dr. Ryan Szepiela here with us to answer your questions on Ask the Expert today. Doctor, thanks so much for being with us.
Thanks for having me.
Well, the first question we have for you says that I've been a smoker for several years. What health benefits could I get from stopping now?
Lots. I mean, there are a ton of health benefits that you get from stop smoking, not only for you, but also for your friends and family. First off, your breathing. Your breathing becomes easier. Your lungs are able to relax and less effort, and also less risk of infections. You can improve your circulations, you'll heal better from injuries, and you'll also be able to be more active, and also your risk of heart disease, heart attacks, they almost fall to half of that of a person who smokes. And also, we don't have to, come in here and forget lung cancer. That also falls to about half of that of a smoker, and you can taste food, senses return, and also it's going to help with your pocketbook because you'll be able to put that money into something else. You'll be able to change the aspect of the people in your family as well. Children suffering from bronchitis, pneumonia, and asthma attacks are all elevated by smoking. So I think if you're really serious and really ready to take that step, talk to your healthcare provider and they can help you along with that.
All right, good to know. The next question we have for you here says that it is cold outside. I was out shoveling, and when I came in, I couldn't feel my fingers. Do I have frostbite?
Yeah, unfortunately, it is cold, and usually the first signs of frostbite are itching and pain of the skin and developing white, yellow, or red patches. They'll become numb. This type of frostbite that we all normally get when our gloves get wet and we're outside for a little period of time ends up being reversible. Only the top layers of the skin actually get frozen, and if you warm up your hands or feet, it'll generally feel better with no long-term damage. However, if you remain in the cold, blisters can form, and then that freezing can go into deeper tissues, and then frostbite can happen in that area, and that's when permanent damage can happen. So you should try to keep your hands warm, feet warm. This includes wearing the appropriate attire, coming in if you're getting too cold, and making sure that you're not getting into that snow or other areas where your gloves get wet and they kind of hold in that cold, and make sure that your gear is okay to be outside during that period of time so that you don't expose yourself to these risks.
All right. Thank you for that, and because it has been cold out here lately. And the next question we have for you says that I have had an awful cold for about 3 to 4 days now. I went to my doctor yesterday, but she didn't give me an antibiotic, and I feel terrible. Why don't doctors prescribe antibiotics as much as they used to?
It's tough when you go to your doctor and you do expect an antibiotic and you come home without it, but this is the reason is that most colds are caused by viruses, which antibiotics actually do not treat. So if we give antibiotics for viral infections, they actually don't change the course or change your overall symptoms. We actually do more harm. We can make future infections more difficult to treat, and not to mention people can have serious side effects of any medication you take, including antibiotics. But most colds in general, healthy people do not warrant antibiotics until they are present for more than at least a week, or the symptoms are extremely severe with fever or cough or production that's affecting your breathing or other aspects of your health.
All right, and doctor, the last question we have for you here says that I have been having a lot of knee pain in the last few months. Is there anything I can do to help it? I don't want to have surgery.
Yeah, joint pain is very common, especially in the knees. We have to put all of our pressure and weight on them. We can do twist and turning that can injure them, and including when you want to start an exercise program or you're moving from outside to inside, your knees can start to ache. That doesn't mean you need surgery. When your knee pain starts to come on, number one, I would say take a couple days rest. Avoid what was causing the pain. You can change up your routine. It doesn't mean that you necessarily have to stop moving or stop doing activities, but you need to change some of the activities in the gym. Also, conservative treatments, icing, easy stuff like anti-inflammatory medications can help. And then overall, weight loss, diets, and strengthening can help these areas. Now, if you continue to have pain, or if you're getting clicking or locking in the knee or something that just doesn't feel right, you need to see your primary care doctor or your healthcare provider that can do a little bit more for you. They can get you into the appropriate therapy, they can get imaging for you if you need, and they can go the next steps in treatment to identify what the problem is.
All right, doctor, thanks so much. Well,
Winter is just around the corner. Prepare your home now for tough weather conditions. Call Erie Metal Roofing. Your roof is the first line of defense between your home and the elements.